The clock's ticking on telehealth access for millions of Americans, and because of the glacial pace of Congress, we're barreling toward a healthcare cliff that could leave patients in freefall going into the new year. I'm David Smith, and here's my read on the tea leaves for August 20th, 2024. Since the start of the pandemic, tens of millions of Medicare beneficiaries have come to rely on provisional and initially temporarily expanded telehealth services. For many, particularly those in rural areas and for those with limited mobility, they're essential lifelines to accessing safe and high-quality health services. The pandemic-era telehealth rules are set to vanish at the stroke of midnight on December 31st. And while there's bipartisan support for extending these telehealth flexibilities, the process is caught in a bit of a political quagmire. Congress is expected to address this, but likely not until after the election as part of an end-of-year omnibus package. Here's what's on the line if these flexibilities aren't extended. Number one, a supermajority of Medicare patients could lose access to remote specialists, curtailing significant services that patients have come to depend on. Number two, mental health services via phone might vanish, a devastating blow to those without reliable or accessible internet services. Number three, fewer Medicare-approved telehealth providers, which will disrupt care for millions of seniors. Number four, more required in-person visits, burdening the elderly and the disabled. And number five, loss of hospital-at-home programs, forcing returns to traditional settings. These aren't just inconveniences. They represent potentially life-altering barriers to safe, effective, and affordable care for underserved individuals, families, and communities across the country. As mentioned in Politico, Kyle Zebley, Senior Vice President of Public Policy from the American Telemedicine Association, didn't mince words, saying, "This is no way to run a healthcare system." I had a chance to catch up with Kyle last week and invited him to elaborate on his thoughts.
If Congress doesn't take action prior to the end of the year to extend these pandemic-era telehealth Medicare flexibilities, we're not going to just get dragged back to how telehealth looked in January of 2020. We're going to get dragged back to 1997, the last major time Congress took action on Medicare flexibilities. That's going to be devastating for beneficiaries. The care that you can receive as a Medicare beneficiary within the comfort of your own home or wherever you might be located, that's gone. It's over. And it's over because Congress hasn't taken action.
The uncertainty is forcing telehealth providers into a high-stakes guessing game, crafting contingency plans for a worst-case scenario. Helen Hughes from Johns Hopkins Medicine said they're trying to assume Congress will follow through, but they're also preparing for a potential unwinding of care. That phrase should send chills down all of our spines. Aside from having the conversation about these short-term extensions, we need to shift the conversation to the longer-term integration of telehealth into our healthcare system. This means addressing issues like interstate licensing, reimbursement, and creating an environment where consumers and practitioners trust these systems as reliable and sustainable pathways to access. The months ahead are critical. The future of American healthcare is at stake, and it's time for bold, decisive action to ensure telehealth remains a core component of healthcare in America. For more insights into the evolving healthcare landscape, sign up for our Tea Leaves newsletter at thirdhorizonstrategies.com/tea-leaves. See you next week.